Hey everybody, Dr. Rapid from Vet Triage. We are continuing through this issue of Veterinary Surgery from February of 2022, and we're going to be talking about fixation of a scapular body fracture in a 5-month-old foal using 4.5, 5.0 millimeter locking compression plates. This study comes out of Japan, and just for folks who don't know what these things typically look like, this is a dog with a scapular fracture, and they placed here, from what I can tell, at least a bone plate cranial and a bone plate caudal to the scapular spine, another bone plate going across the base of the scapula here. So we don't have images for this horse that I can show you, but at least you can see what it would look like on radiographs in a dog. Objective is to report a surgical technique and an outcome for the repair of a displaced transverse scapular body fracture with locking compression plates in a colt. Locking means that the bone screw locks into the plate, as opposed to conventional methods, which are called compression plates, where they don't lock into the plate. The bone screws have to rely on their penetration into the bone. And then compression means that when you place the bone screw into the bone plate, it actually is going to cause compression of the fractures from end to end. And that's based on the plate design and how you place the screws, what order you place the screws, that kind of stuff. This is a 5-month-old thoroughbred colt that weighs 256 kilograms. They use 4.5/5.0 millimeter locking compression plates with 6.5 millimeter cancella screws, 4.5 millimeter cortex screws, and 5.0 millimeter locking head screws. Implants were removed 2 months after surgery. 3 months after the internal fixation of the scapular body fracture, the colt was sound and was turned out to pasture. 1 year later, he was sound and training to be a flat racehorse. Introduction. Scapular fractures are rare in horses. The majority of scapular fractures occur at the supraglenoid tubercle, and fractures of the scapular body and neck have been less commonly reported. The prognosis for horses with transverse body fractures is fair in young horses and guarded in adult horses. A clinical commentary describes non-surgical management of a scapular body fracture may be applied in select cases, like simple fractures in adult horses. However, horses with displaced unstable transverse fractures of the scapular body are best treated with internal fixation. Early stabilization of fractures in foals to facilitate weight bearing is important to reduce the risk of angular and flexural limb deformities of the contralateral limb. There have only been 3 case reports of this, and they used a dynamic compression plate or semitubular plate or a locking compression plate. In this case here, they collected radiographs which did not reveal the scapular fracture. Ultrasound did show it, swelling of the soft tissue and a step in the cortex in the proximal scapula. And here the white arrow is depicting where the step is. You can see how there's one white line that goes horizontal, and then a second white line that's stepped down in front of that white arrow, and that's the fracture itself. With surgery, they gave the horse metatomidine, butorphanol, dihydrostreptomycin sulfate, benzyl, penicillin, procaine, ketamine, midazolam. They use a 7-hole 4.5/5.0 millimeter locking compression plate, parallel and cranial to the scapular spine, and then a 2x4-hole 4.5/5.0 millimeter locking compression plate caudal to the spine, crossing the caudal-distal fracture line. Oh, and here's a drawing of what the fracture looked like. Again, radiographs in horses in this area are not great because of all the structures they get in the way, so ultrasound and the drawing was the best bet that they have to show us what's going on here. This is the surgery itself. So you can see there, so where that white arrowhead is, that's the scapular spine, and that longer single plate is cranial to the spine. Those 2 smaller plates at the bottom of the picture, those are caudal to the spine. Post-op care was procaine, penicillin, gentamicin, phenylbutazone, omeprazole. 2 months after surgery, they removed the implants because they wanted to sell the horse. The timing of the implant removal was based on the basis of clinical improvement, normally based on radiographs, but that wasn't an option here because it's a horse. 1 year later, upon examination by the referring veterinarian, the horse was sound and in training to be a flat racehorse. Discussion. Scapular body fractures in foals have been repaired using a 4.5 millimeter semi-tubular plate or two narrow 3.5 millimeter dynamic compression plates with 3.5 millimeter cancellous bone screws. However, the foal treated with a 4.5 millimeter semi-tubular plate became sound after a long period of not being able to bear weight, and the one that was repaired with the two narrow dynamic compression plates remained lame at a trot 60 days after surgery. The failure of an early return to soundness in these cases may be attributed to the biomechanical properties of conventional plate fixation techniques in the scapula. The thin scapular body with thin cortices may not provide sufficient screw pull-out strength to overcome physiological forces using conventional plate fixation techniques. Cortical bone screws inserted into thin cortical bone have a decreased screw bone contact, putting the fixation at risk of implant failure by stripping the screws or making them loose. The use of a locking compression plate has been reported to provide better holding power in soft bones such as the pelvis. Screw loosening also occurs less often in iliofractures repaired with locking compression plates than in iliofractures repaired with dynamic compression plates in cats. In this case, the colt was sound at 2 months after surgery, which is faster than other reports. The locking compression plate constructs may offer biomechanical advantages in equine scapula, leading to an early return to soundness. Radiographs are considered the best imaging modality for scapular fractures, but imaging of the body of the scapula is difficult because of superimposition of ribs and vertebra over the scapula. Ultrasound in adult horses has been used to identify the extent of scapular fractures. You can also consider CT scan, computed tomography, as well. Plate removal is commonly recommended after long bone fracture repair if the horse is intended for athletic use or public auction. Plate removal in foals can be performed as early as 4 to 6 weeks after surgery if the fracture has healed. And so, my only comments really they already addressed, whereas there's no pre-op radiographs, no post-op radiographs. Ultrasound may not have worked because of the shadowing from metal. It probably wouldn't have shown the fracture site. It would have been nice to have had an ultrasound post-op after they removed the plate to show that the cortical bone was now intact. And then, of course, CT scan would have been good as well. But anyway, cool, unique case, and it's good. Horses end up getting euthanized a lot for fractures, so it's good that we're trying to figure out ways to repair them. Thanks for supporting the channel. We'll see you in the next one. Bye-bye.